The granddaddy of all knee injuries, the ACL tear. It is one of the most debilitating injuries in the sports world, and it's a tough rehab. Now, it used to be that if they found any sort of ACL tear, it wouldn't be a question, you'd be getting surgery. However, there's been some science happening recently. Some really cool research being done about non-surgical treatment for the ACL and finding that there are some high-level athletes, one example being Tyjae Spears, running back for the Tennessee Titans, who I'm a fan of, unfortunately. But it was discovered while he was playing college football that he basically doesn't have an ACL. He tore his ACL back in high school, had it repaired, but over time it just didn't go well. And after another MRI, it was shown that it's basically gone. He has pretty significant knee arthritis, but he's playing football for the Tennessee Titans, and he's doing pretty well. So it begs the question, is it possible to rehab an injury like that without surgery, and what the function of the ACL is and how the body can adapt around it if it is lost? Now, this is not meant to ruffle all the feathers in the world and say ACL surgeries are, bull crap, because some people need them. If you're a high-level athlete, you have a full ACL tear, it's been shown that, if you want to continue playing high-level sports, usually that's the best way to go. However, there's a certain population that research has shown actually has the same or even better outcomes with non-surgical treatment of an ACL tear. And there's 5 criteria for those people. Number 1, it's just the ACL that was torn. No MCL, LCL, PCL, all that's clean. Number 2, no joint effusion. Number 3, single leg hopping test of at least 80% on the injured leg versus the uninjured. 70% quadriceps strength on the injured versus the healthy. And then the last one is full pain-free range of motion. Now, you can do some physical therapy to get up to that level. And if you reach those 5 criteria, it's possible that you don't need surgery, or at least you can continue to try it until you want it. And this research was backed up with a study that took 80 people with an ACL tear. They put them through a non-surgical treatment protocol. And after 3 months, 90% of those 80 people showed healing of the ACL after 3 months. And those people had a significantly better long-term outcome. I'm reading the research. I'm just saying I'm surprised too. It's really cool to see what's happening with ACL research. Now, going back to my man Tyjae, obviously no ACL, significant knee arthritis, and there's a reason for that knee arthritis. That's another way that the body copes with not having an ACL. It stiffens up. It's trying to protect the knee by making it less mobile, because the function of the ACL is to prevent excessive motion of the bones, essentially. And by stiffening up, it's preventing that excessive motion. However, that arthritis can become an issue over time. However, again, arthritis doesn't necessarily mean that your knee's just done for and you don't have any hope of ever, returning to sport. The dude's playing NFL football right now. Okay? But I would imagine that dude has the strongest quads, hamstrings, glutes, core on the team. Maybe besides Jeffrey Simmons, he's an animal. But there are ways that your body adapts to these things. And that's an ACL's, that's the example that we're using. But think about any injury. Your body is so brilliant that it will find a way to work around it. And I'm not out here saying that surgery is just never an option. You should never do it. Sometimes, surgery is the best option. But the reason for this post, and the reason that I'm going to continue making posts like this, is that we need to start rethinking the amount of surgery that we're doing. Giving the body time to heal and learn how to work around it for certain people with certain restrictions that they might not be able to, play high-level sports. They don't want to, go out and do crazy things. They just want to live a fairly normal, active life. Like, they might not need surgery. They can live a fairly good life without having to go through the whole process of surgery, paying for it. And sometimes there are complications with surgery. Sometimes surgeries fail. And again, I feel like I'm not making very many friends with surgeons right now, because it's not that I'm attacking them. It's more so just reading the research and knowing what's going on. So yeah, this is going to be an ongoing series on the ACL. I'm going to be making some videos about how to treat an ACL tear non-surgically, and also if you do have ACL surgery, what the phases of that rehab should look like. Some clinical pearls I've learned in my few years of treating and the research that I've done. So if you've had an ACL tear, if you're just interested in learning more about it, stay tuned and we'll talk more about it. All right. Science is cool, right?